So today marks 233 days. We're in week 34 since we had our first COVID-19 case back on March 12th. And ironically, since I sat here and gave the COVID briefing 4 days ago, we had 110 new positive cases in just the 4 days. 110. On Monday, we had 14 people in the hospital, 1 in the ICU. Yesterday, we reported 24 people in the hospital, 2 in the ICU. And I'll get to where we are today in just a moment. But our numbers continue to go in the upwards direction. As of this morning, there are now 3,579 positive cases of the coronavirus in Albany County. 1,331 people under mandatory quarantine. We have a total increase today of 53 positive cases overnight. That's 53. We had 19 positive cases yesterday. Of the new positives for today, we also know that 20 had close contact with positive cases, 16 healthcare workers, 2 people that reported traveling, and 15 people did not have a clear source of infection. And I know that's one question we get on Facebook all the time. And Dr. Whalen can answer this better, but I will say this. It's because when they're epi people, they're doing the tracing, when they're talking to people, they're not being honest. If you're not being honest, we can't get to the clear source of the infection. You're not protecting anyone. We're not going to arrest you. We're not sending Sheriff Apple to your door to throw you in jail if you're lying to us. It helps us do our job, and please work with the health department. It's an issue when people aren't clear. So that's where you get sometimes where we can't figure out where the source is coming from, because people are like, oh, I had no contact, I didn't see anyone. It makes it difficult when we have to make decisions. We're not knowing where the clusters are coming from. 16,071 people have completed quarantine. 3,392 people tested positive for the virus and have recovery. That's a 23 recovery since yesterday. So now talk about the hospitalizations. As everyone's aware of, the governor changed some of the zones, red zones, orange zones, depending on what hot spots are going on in hospitalizations. And if you get over 2%, that's when things kick in. So right now, as of today, we have 27 people currently hospitalized. We had 3 new patients overnight with a hospitalization rate of 0.75% of those who have tested positive. Yesterday, that rate was 0.68. 2 patients are currently in the ICU. Yesterday, that number was 2. And like I said at the last briefing, we are trying to figure out, are people staying in the hospital longer? I mentioned I had a family member. It's week 3 they're going into, still in the hospital. So people seem to be staying in longer, but I can't confirm that. We're going to let the science do their job and let the doctors, like Dr. Whalen, sit there and look at the statistics of what's going on and why people are staying longer in the hospital. Over the last 5 days, there's been an average of 26.8 new positive cases each day. It was yesterday. It was 21. So our positive cases are climbing up. Our hospitalization is at the highest it's been since I believe since like June 1st, somewhere in that area. It's one of the things we have to be concerned about. We keep telling people, please wear your mask. Cough into your arm, clean your hands, socially distance. I know people have COVID-19 fatigue. It was a great story the other day in the TU with the doctors from Albany, Advanced, St. Peter's, and the other ones. And if you go online, it's happening all around the world. People are tired. That's why I continue to say 233 days later, I'm tired. Everyone gets tired, and it's okay to be tired, but we have to stay vigilant. And the only way we're going to get through this is to continue to do the right stuff. So the governor has given us the percentage of positive test results reported over the last 3 days in the capital region. So Tuesday and Wednesday netted a 1.3%, 1.1%, and 1.3%. These numbers are higher than we've had before. And again, if you look around what's going on, Dr. Whalen and I said this 34 weeks ago, believe it or not, when we pointed out about Italy. We've always seemed to be behind at what's going on. You watch it start in New York City, work its way up this way, and it's scary now to see France, Germany shut down. Ireland just shut down for 6 weeks. The UK is talking about shutting down or moderately shutting down again because of everything going on with the second wave that's hitting them. Flu season seems to be better because people are wearing masks and you're not having as many flu cases going on. But again, I'm recommending to everyone, please get your flu shot. Please do everything that you can. And it's tough. Yesterday we announced that 4 people at our county health department tested positive. I'm happy to say 63 others all came back negative. And, what's scary to me, that kind of rocked me to the core a little bit when I was talking to Dr. Whalen, before masks were mandated, before all this stuff went down, you couldn't walk into your building. She had protocol set up. She had the security making sure no one got in the building without a mask. It didn't matter if it was me. You were more locked down than our nursing homes. And, it's scary when you sit there and you go, people doing the right thing, setting the example, and I'm like, if it can happen there, it can happen anywhere, right? And again, I'll let Dr. Whalen talk about it, but I can assure you that's been the department leading the way for the rest of the workforce of how it's supposed to be done. And I know still people go into restaurants or stores, they take the mask off or they don't want to wear a mask, and people have issues and they go to Paul's, New York. If you walk through her health department, you will see the right examples being set, not just by her and her upper staff, but by all the workers. And it's been that way since pretty much, I want to say in the beginning, before all the experts came out and said that. And she was just like, we're wearing masks in here now, county executive, you got to put one on. I'm like, okay, and again, it was a smart thing to do. So I do want to thank her for her leadership there. There isn't a rule book on this COVID-19. And I've said this, when I talk to people out on the streets or I'm talking to workers, we are going to make mistakes. We have made mistakes. You learn from that because there's no way of dealing with this. We weren't prepared for it. No one was prepared for it. We saw it coming. We saw how it was affecting the other parts of the world. You look at the World Health Organization, you look at CDC, you look for guidance from all the doctors. Again, we're all dealing with it. In the beginning, no one was mandating masks. Then it was masks. Then it was clean your hands. Then it was don't do this, don't do that. As we learned, and as you see, it's affecting other parts of the state. It's coming back and affecting us differently. I'll let the science speak for itself. But again, we have to adjust fire and we have to adapt to the situation that we're in. And when you make a decision, I've said this, it's hard when I put my head down at night. I got to make damn straight sure that every decision I made was the right decision protect the people of this county, just like Dr. Whalen does every day, and has quietly until everyone really realized what the health department does in the county. But these are decisions we have to make every second of the day and readjust as things change. So it is tough. We're not always going to get it right. But again, we learn together. And if we're in this together, working together in a partnership, we'll get through it. But we're not going to get through it by pointing fingers. And I love to say this, the Monday morning quarterback, the person that likes to come in the next day and tell you should have done this, we should have done that. And I'll say this to the workers, speak up. If you have a better way of handling something, you see something unsafe, don't be afraid to say something. You're not a snitch, you're not a tattletale. This is real live issues we're dealing with. So I do encourage the workers, call your workers out for not doing the right thing, because this is about your health, your family's health. It's one of them things we talked about with Halloween tomorrow, Thanksgiving coming up. Again, the governor set some great guidance out there of what to do and what not to do, and we should follow it. It's different. 2020, I think, if I took a vote right now, I don't think there's anyone in this room who can't wait for next year, and we hope next year is going to be better and get back to some type of normalcy. Same way. And again, I do want to say to everyone, we are trying. So as this thing has evolved and changed, we have made decisions on the county implementation and continuum of operation plans, which we call our COOP. So we had to do things differently. We had to learn. And County government is a lot different than a regular private company because it's harder to change that philosophy, the cohesiveness, to be resilient in a lot of cases of delivering services. So we've learned a lot, and as we've learned a lot, some departments we're staggering shifts again. We're going to go back to some staggering shifts. Some will have remote workers. Some will have rotating days in and out of the office. So we're going back to changing it, just getting prepared. Like I said in the beginning on day 2 when we set up the thing for the mental health doctors, because I learned that being in the military and in Iraq. But most importantly, we divided up our command staff into 3 segments. And I do want to thank Sheriff Apple and all that for his leadership and his EOC, but helping us in doing things going forward. And especially I want to say thank you for cleaning the health complex yesterday with your machines. But I recommend, is this, what are we faced with? Well, when I see 53 new positive cases overnight, or 3 more people in the hospital, and our hospitalization rate continued to grow. It's cold season, first snow, not the first snow of the year, but the first snow going into the new year. We got to be ready. We have to be ready. And I say this to all the businesses out there, be ready. Albany County services will continue, but then again, we'll be limited to the number of face-to-face that we're going to interact in our buildings. We have the technology now. We set it up for our workers to work at workstations at home, to do more work at home, to be productive at home, and to continue on to our services that people are entitled to, that are used to, and that need, and they will not fall through the cracks on any of that stuff. We're prepared and ready to continue using what we learned to keep everyone safe. We also need everyone, again, to wear a mask, socially distance themselves, cough and sneeze into your elbow, wash your hands as often as you can. We need people to continue to get tested. One of the things I'll say is that USA is the number 1 in the world right now for the amount of deaths that we have. I think over 243. And our testing, though, has been over 141 million people. And if you look at that, for a population of roughly 330 million Americans, that's a lot of testing we got going on. So you can argue, and I'll say this to the Facebook people, I'm not going to answer you today. I can't tell you, because we're testing, our numbers are going up, more people are getting tested. I just know our numbers are getting higher, okay? You look at India, a population of 1.3 billion people, and yet they're number 2 for having the most amount of. We got 9 million people that basically have this. They have about 8 million. So we got 9 million, they got 8 million. They tested 106,000 people, or 106 million. A lot less than us if you look at the percentage of 1.3 billion population versus 330 million people. Don't mean to throw a lot of numbers out there at people, but you got to look at the testing. Our governor set the stage for the rest of the nation, setting up testing, getting it done, because that's the only way we're going to map and trace it. And I'll let Dr. Whalen talk about that. But again, there's plenty of places to go that don't charge for the test, and our testing sites, and we'll pay for it if you don't have insurance. We don't want people to worry about that. Continue to say that. Go to our website. You'll have a continuous list of places that you can go. Testing is free at the state testing sites in the University of Albany. You can schedule an appointment by calling 1-888-364-3065. Our Whitney Young mobile testing sites, as always, have testing available for kids also there. So please, if they have any symptoms, call there. The number is 518-465-4771. CVS stores have the drive-through. The locations are 885 Central Avenue and 3916 Carmen Road. And you can go to their website, Albany Med, urgent care, and they have the nasal swab and antibody testing in our Priority 1 in Guilderland. You can also go to Central Med Urgent Care on Central Avenue, Community Care Physicians in Latham, Rite Aid in Colony, and I could go on and on. We have a lot of testing going on and very convenient for everyone. I do want to thank Albany Med and St. Peter's for their leadership and working with us on this, and I know Dr. Whalen will get into it more on all that stuff. So I do want to say that I do thank Dr. Whalen for her leadership. It's challenging. It's challenging for everybody. And again, I keep reminding everyone, it's a marathon, not a sprint. Take a step back, take a deep breath. We'll get through it. Again, not all of our decisions are going to be right. We're just trying as we're going, and we're learning. And it's that hiccup that we have every now and then, or that pebble on the road that we trip on, and we have to readjust and figure out. And sometimes what we're told today is different than tomorrow. But again, we're in it together. So please be part of the solution, not part of the problem. Let's work together in a partnership, and we can get through this. This is what I love about Albany County and the Capital District. We're the best in New Yorkers. When we get knocked down on our butt, we get back up, and we're stronger than we were when we got knocked down. Dr. Whalen.
Thank you, County Executive McCoy. So I first would like to address the fact that we are starting to see our numbers uptick. With 53 cases yesterday, we are concerned. We are concerned that we are starting to see in the last few weeks an uptick in numbers that could, in fact, be what we have been concerned about all along, the beginning of a second wave. The data will show whether that's the case in the coming days and weeks, but it's important that the public be aware that as we enter this cold and flu season, that they continue to do the best that they can to support themselves and protect themselves. In addition to the measures that we have discussed, it is also important to get a flu shot. We do not want to have the hospitals overwhelmed by people with flu. In addition to people with COVID, we want to protect our hospital surge capacity, so I urge everyone to get their flu shot. I got mine, and there's availability, and contact either your primary care doctor or a pharmacy or the health department. When we resume our clinical services, we will be happy to assist. I do want to talk about the cluster of illness in the health department. We were notified last week about a staff member who tested positive and immediately discussed contacts that he may have had within the health department and recommended testing for those individuals. When we broadened the net a little bit, we got additional positives, and that is why the decision was made yesterday to get the remainder of the staff that are working in the building tested. I'm happy to say that of the 63 additional staff that were tested yesterday, all are negative. I'm happy to say that I tested negative. I have not been identified as a contact. Had either of those things come back positive, I would not be sitting here before you. We tackled this as we do every other cluster and work to provide case investigation, to get details of contacts of the cases, and to ensure that those that were in contact will remain on quarantine for 2 weeks to prevent spread to other individuals. We have also made the decision in conjunction with the county executive to go remote for 2 weeks. This is something that we had planned for. It is something that we had early on considered maybe an action that we had to take. We had a lot of support from our IT division to ensure that staff has the technology that they need to have to continue case investigation and contact tracing efforts working from home, along with all our other public health programs and services, with an exception of an interruption of our clinical services for the next couple of weeks. Staff are very dedicated to continuing the work that they do and to continue to fulfill our mission to protect the public health. I do want to discuss the fact that, in our building, from day one, we have advocated for the use of masks, hand hygiene, and social distancing. The fact that we have cases within the building does not translate to the fact that masks don't work. I don't think you have to be a doctor to know that there are no guarantees in medicine, and what we can do for the public is to advise people, as we advise our own staff, as we advise our own families, based on evidence. And evidence suggests that mask wearing protects you. Is it a guarantee? Is it a guarantee if you wear a mask that you won't get COVID? The answer is no. But you are protecting yourself, and there is less of a chance that you will get it. I read a comment on Facebook, if Dr. Whalen can't protect her own staff, how are we supposed to listen to how she tells us to protect ourselves? And I can understand this, it's a legitimate question. So what I'll tell you is that I cannot protect every single resident in Albany County from getting COVID. If I could do that, If my department could do that, we would not still be sitting here 233 days later. What can you count on from me and from my department? Well, you can count on 27 years as a physician, and 17 of those years in public health, training in public health and preventive medicine, and board certification in that and in internal medicine, and the ability to look critically at the evolving, rapid situation and hone out the appropriate recommendations based on evidence. I will share those with you and have been sharing them here on a daily basis. What else can we offer you? I am very lucky to say that I work with the best team I could ever wish to have. A dedicated team of professionals who have been working 7 days a week for the past 233 days to ensure that we continue our mission to protect the health of Albany County residents using evidence-based strategies. This is something that we continue to do on a daily basis. And this is our commitment to you. At this point, masks, social distancing, hand hygiene, and avoidance of crowds are the best strategies that we can provide people to protect themselves against a disease that we are seeing increased rates of in the community and increased severity. So I would advise people to continue to follow those strategies, and also to consider when you are leaving your house whether you need to leave your house. Do you need to be part of a social gathering? Do you need to be part of a party? This isn't the year for social gatherings or parties. It is important for all of us to do our part and to do what we all can do to stop the spread. So, like other public health professionals, I am encouraging against gatherings. I am encouraging towards mask wearing and social distancing. I also do want to comment on something else that I think I'm starting to see, and I'm not necessarily a person that looks at comments on Facebook or other places, but we've started to see a really disturbing trend of people vilifying individuals who've been diagnosed with COVID. And this is not helpful. It is not helpful at all. I had a staff member who was positive apologize to me. That should not happen. People get COVID sometimes if they do all the right things. And it is not anybody's place in any circumstance or situation to vilify or call someone out or condemn those individuals that are suffering. We talk a lot about being part of the solution and not part of the problem. And I would encourage people, we all have COVID fatigue. We're all tired. We're all working our best and doing our best to protect the health of the public. When you go to make those comments, consider what the repercussions of those comments are. We need to help. We need to help going forward. We don't need to point fingers. We don't need to blame individuals for a disease that no one heard about a year ago today. We're all learning about this together, and it is the responsibility of all of us to act in each other's and our own best interests. Thanks.
Thank you, Dr. Whalen. And I'm glad you addressed the issues on mask wearing, because I do stand behind her, and she was way out in front before anyone else got out there on the mask. And, when you see these comments, you try not to let it bother you. I'll be honest, but we're human. We're only human, and it kind of gets to you. And, or the people that think in 4 days after the election this is going away. It's not going away, people. It's going to be here. It's going to be here November 5th. It's going to be here November 6th, 7th, and 8th, and so forth. It's not going away with the election. And then there's the people that don't believe in it. And then you see when people do get it, people point the finger. Told you it was real. And I will say this. My brother-in-law, Kevin's probably going to kill me, but who's still in the hospital. He didn't believe. He didn't think it was this thing that was, that everyone was making it out to be. And you know what? opinions change, but it shouldn't take him being in the hospital for almost 3 weeks to change his opinion. But again, that's the fact that we're in. People don't want to believe what's going on around us. They want to think it's made up, and we're all making a big deal out of it. More people die from the flu season. I don't know. And the fact that, again, I keep saying, be part of the solution, not part of the problem. Come up with solutions that can help us move forward. How we can stay opened. How we keep businesses open. How do we keep small businesses going? How do we keep restaurants moving in the right direction? The mom and pop stores around the Capital District. How do we keep these small businesses operating with your help in doing the right thing and staying vigilant through this whole thing and with the COVID-19. But again, Dr. Whalen, to you and your staff, DGS, all the staff that's doing the right thing and helped us get through it, thank you. And oh, sorry, go ahead.
I just want to thank, in particular, Albany Medical Center, who has been a great partner through all of this and did assist with testing of our staff. Doctors McKenna and Venditti have been great partners, always on the other end of the phone if necessary. And in particular, I'd like to thank Rebecca O'Donnell, who is infection control practitioner extraordinaire at Albany Medical Center, who is also, one of my frequent contacts these days. It was a big assist for our department and allows us to continue the critical services that we are giving to the public. So thank you to Albany Medical Center.
Thank you. And again, moving forward, we got our first taste of winter this morning. I just want to share a few pictures from our DPW up in Hilltown, that they're out there, the men and women out there keeping our roads safe for our people. But again, thank you for all that. As always, our mental health support's available 7 days a week from 8 a.m. to 5 p.m., 518-269-6634. Our 24-hour sexual assault hotline number, 518-447-7716. Our 211 and the New York State hotline, as always. So please reach out. We're here for you. And stay safe. Continue to be doing the right stuff out there and wear your mask.